Narcissistic personality disorder, NPD, is a mental health condition characterized by an inflated sense of self-importance, a deep need for admiration, and a lack of empathy for others. People with NPD have an exaggerated sense of their own abilities, accomplishments, and uniqueness, and they often seek attention and recognition to validate these perceptions. This behavior can cause significant distress and impaired functioning in relationships, work, and social activities. The exact cause of NPD is not well understood, but it is believed to be a combination of genetic, environmental, and psychological factors. There is evidence that NPD has a higher incidence in close relatives, suggesting a genetic predisposition. On the other hand, childhood experiences, such as excessive praise or criticism, can also play a role in the development of NPD. People with NPD display a range of symptoms that are often associated with this disorder. These include an exaggerated sense of self-importance, a need for constant admiration, a sense of entitlement, a lack of empathy for others, and an excessive preoccupation with fantasies of power, success, and attractiveness. They also tend to be highly sensitive to criticism and rejection and can become angry or hostile when they feel their ego has been threatened. To be diagnosed with NPD, an individual must meet specific criteria as outlined in the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition. The criteria include an enduring pattern of grandiosity, a need for admiration, and a lack of empathy, which leads to significant distress and/or impaired functioning. The individual must also have a history of exploiting others for personal gain and a tendency to become envious of others or believe that others are envious of them. Treatment for NPD typically involves psychotherapy, such as cognitive behavioral therapy or psychodynamic therapy. During therapy, individuals with NPD can learn to understand and manage their thoughts, feelings, and behaviors, as well as develop new coping strategies to manage their symptoms. However, it is important to note that people with NPD often have a resistance to change and may not seek treatment voluntarily. Narcissistic personality disorder is a complex and challenging mental health condition that can cause significant distress and impaired functioning in many areas of life. People with NPD have an inflated sense of self-importance and a deep need for admiration, which can cause problems in relationships and other areas of life. With appropriate treatment, individuals with NPD can learn to manage their symptoms and improve their overall functioning.